Could the state soon get a new health care system? Governor Bill Lee may soon ask the federal government to give us money to do just that. And as News Channel 5's Kyle Horan learned, questions on whether or not that will be helpful are on a lot of people's minds.
Republicans at the state capitol want to take over health care.
Tennessee has proven over the last several years that we can manage our state effectively and efficiently. And that's exactly what we want to be able to do with the TennCare system.
Senator Paul Bailey believes one of the major legislative wins for the Republicans this year is also a win for the people of Tennessee. He says the block grant bill, an initiative for the governor to ask the federal government for federal funding for Tennessee's healthcare system, might mean more meaningful health care in the state.
TennCare is at 100% of the poverty level as far as the amount that we receive from the federal government. In this legislation, it would actually give TennCare the ability to negotiate a higher percentage than 100% of the poverty level, which could ultimately mean that we could cover more Tennesseans.
But not everyone is optimistic. There was opposition at every stage of the bill, and now that it's passed, that hasn't changed. Michelle Johnson with the Tennessee Justice Center says this could be harmful to people who currently rely on Medicaid.
And the fact that they haven't actually been able to articulate what they want other than flexibility in a program that has, there's nothing they've asked for from the federal government that the federal government hasn't given them the right to do.
Then there are others who fall in the middle. An expert at Vanderbilt told me it could be beneficial for the state as long as it's negotiated wisely. Kyle Horan, News Channel 5.
Currently, the state receives $2 from the federal government for every $1 spent by the state. The block grant would be a lump sum. Senator Bailey says they would make sure they're covered if medical costs in Tennessee rise.